Today, we're diving into the 10 warning symptoms of oral cancer that often go unnoticed. Signs you might be ignoring every day. Let's get right to it so you can protect yourself and your loved ones with knowledge that could save a life. First up, mouth sores. These small, often round or oval lesions can appear anywhere inside your mouth, on your tongue, the inside of your cheeks, your gums, or even the roof of your mouth. Most people experience them at some point, and they're usually harmless, caused by things like accidentally biting your cheek, irritation from braces, or even stress. But sometimes a mouth sore can be a sign of something more serious. Most mouth sores heal on their own within a week or two, fading away as your body repairs itself. But if you notice a sore that sticks around for more than 2 weeks, that's a red flag you shouldn't ignore. This is especially true if the sore doesn't seem to be getting smaller, or if it's not responding to your usual home remedies. It might not hurt at all. In fact, many persistent mouth sores are completely painless. That's why it's so important to pay attention to how long a sore has been there, not just whether it's causing discomfort. Persistence is the key issue, not pain. Make it a habit to check your mouth every day. Look at your tongue, the insides of your cheeks, your gums, and the roof of your mouth. Even if you don't feel anything unusual, a quick visual check can help you spot changes early. Use a small mirror and make sure you have good lighting. This simple routine can help you catch any unusual spots, sores, or ulcers before they become a bigger problem. If you wear dentures or braces, remove them to get a better look at all areas. Don't rush. Take a minute to really look. If you spot a sore or ulcer that won't heal, don't wait for it to start hurting or for it to get bigger. Early detection is crucial. Remember, not all dangerous sores are painful. Some of the most serious ones can be completely painless, quietly growing without you realizing it. That's why it's so important to act on what you see, not just what you feel. Think of a persistent mouth sore like a crack in the sidewalk. At first, it might seem small and harmless, but if you ignore it, it can grow and become much more dangerous over time. Addressing it early can prevent bigger problems down the road. The 2-week rule is simple. If a sore hasn't healed after 2 weeks, make an appointment with your dentist or doctor. They can examine the sore, ask about your medical history, and decide if further tests or a biopsy are needed. Early checks save lives, especially when it comes to oral cancer. Oral cancer is much easier to treat when caught early. Many people ignore persistent sores because they don't hurt, but waiting can allow a serious problem to develop. Your healthcare provider is trained to spot the difference between a harmless sore and something that needs attention. Don't ignore what your body is trying to tell you. Your mouth can be an early warning system for your overall health. If you notice a sore that won't heal, take action. Your future self will thank you. Next, let's talk about unexplained bleeding in the mouth, a symptom that can be easy to overlook, but is important to pay attention to. Many people notice a small amount of blood when brushing or flossing, especially if they have sensitive gums or are brushing a bit too hard. This is fairly common and often linked to gum irritation or mild gingivitis. However, if you see blood coming from a specific spot in your mouth, especially if it happens repeatedly, and you can't identify a clear reason, like an injury or recent dental work, this is not normal and should not be ignored. Cancerous or precancerous tissue in the mouth is often more fragile than healthy tissue. These areas can bleed easily, sometimes with only minor contact or even spontaneously, without any obvious injury or trauma. You might notice blood on your pillow when you wake up, in your saliva after eating, or even when you're just talking. Sometimes the bleeding is so subtle that it only shows up as a faint pink stain on your toothbrush or in the sink. It's a good idea to keep track of when and where you notice bleeding. Write it down in a journal or make a note on your phone. This information can help your dentist or doctor understand what's happening and make a more accurate diagnosis. Don't assume that all bleeding is just from your gums or that it's nothing to worry about. If the bleeding is persistent, happens in the same spot, or is accompanied by other symptoms like pain, swelling, or a sore that won't heal, it's time to take it seriously. Only a dental or medical professional can determine the true cause of unexplained bleeding in your mouth. Don't try to self-diagnose or ignore the problem. Schedule an appointment and get it checked out as soon as possible. Early detection can make all the difference. Third, Let's talk about lumps or thickened areas in your mouth, lips, or neck. These changes can be subtle, but they're important to notice. Sometimes, a lump or area of thickening might feel like a small bump, a patch that's firmer than the surrounding tissue, or even a swelling that wasn't there before. It's easy to overlook these signs, especially if they aren't painful, but paying attention to them can make a big difference in your health. Make it a habit to run your finger along your cheeks, gums, tongue, and jawline regularly. This simple self-exam only takes a minute, but it helps you become familiar with what's normal for you. Use gentle pressure and pay attention to any areas that feel different. Maybe a spot that's firmer, thicker, or just doesn't match the rest of your mouth. If you notice a new, hard, or fixed lump, especially one that doesn't move when you press on it, take it seriously. Lumps that are hard and immobile are more concerning than those that are soft and move easily under the skin. These could be early warning signs of something more serious, like oral cancer, and shouldn't be ignored. Most lumps are harmless, often caused by minor infections, cysts, or even irritation from biting your cheek. But cancerous lumps tend to be hard, fixed in place, and don't go away on their own. That's why it's so important to know the difference and to keep track of any changes you find. The more familiar you are with your mouth's normal feel and appearance, the easier it is to spot changes early. If you ever notice something new, unusual, or persistent, like a lump that doesn't go away after 2 weeks, make a note of it. Early detection is one of the best ways to protect your health. If you find something new or persistent, don't panic, but do get it checked by a professional. Early action is key. Even if it turns out to be nothing serious, you'll have peace of mind. And if it is something that needs treatment, catching it early can make all the difference. Your dentist or doctor is trained to evaluate these changes and can tell you what's going on. Don't hesitate to reach out if you're unsure. Your health is worth it. Watch for white or red patches. Leukoplakia and erythroplakia. White patches are thick and can't be scraped off. Red patches are velvety and often more serious. Both can be precancerous or cancerous, and you can't tell by looking. Mixed red and white patches are especially risky. Check your mouth for color changes that last more than 2 weeks. Don't try home remedies. See a professional for a diagnosis. Early detection makes all the difference. Don't ignore persistent patches. Difficulty swallowing, dysphagia, can signal oral or throat cancer. If food feels stuck, you need more liquids to swallow, or you start avoiding certain foods, pay attention. Tumors can block or narrow your throat, making swallowing harder over time. If this persists, especially with other symptoms, see a doctor. Don't chalk it up to aging or stress. Swallowing should never be a struggle. Numbness or tingling in your mouth, lips, or chin is a serious sign. Tumors can press on nerves, causing loss of sensation in specific areas. If you notice numbness that doesn't go away, don't ignore it. It's not normal for any part of your mouth to feel numb without reason. See a dentist or doctor right away. Nerve symptoms are never something to wait on. Get it checked promptly. Persistent ear pain, especially on one side, with a normal ear exam can be a warning sign. This is called referred pain, often from a tumor in the throat or base of the tongue. If your ear hurts but your doctor says it's healthy, mention any throat or mouth symptoms. Don't settle for "I don't know" as an answer. Persistent, unexplained ear pain needs further investigation. It's a key clue for doctors. Don't ignore it. Loose teeth without gum disease or injury can signal cancer in the gums or jawbone. Tumors can erode the bone, making teeth unstable. Dentures that suddenly don't fit are another warning sign. If a tooth feels wobbly or your dentures change, see your dentist. X-rays can reveal bone loss from cancer. Don't assume it's just a dental issue. Early dental checks are crucial. Persistent hoarseness, raspy voice, or slurred speech can indicate cancer affecting your vocal cords or nerves. If your voice changes and doesn't improve after 2 weeks, especially if you're a smoker, see an ENT specialist. Tumors can stiffen vocal cords, changing your voice's sound and pitch. Don't blame it on allergies or aging if it lingers. Subtle changes matter. Listen to your body. Friends or family might notice before you do. Get a professional evaluation. Voice changes deserve attention. Significant unexplained weight loss, 10 pounds or more, can be an early sign of cancer. Oral cancer can make eating painful, leading to less food intake. Cancer also speeds up your metabolism, causing weight loss even if you eat normally. If your clothes are looser and you haven't changed your habits, take note. Keep a log and discuss it with your doctor. Combined with other symptoms, it's urgent. Don't ignore unexplained weight loss. Those are the 10 warning symptoms of oral cancer you can't afford to ignore. Early detection saves lives. Get to know your mouth and check it daily. If you notice any of these signs for more than 2 weeks, see a doctor or dentist. Don't wait. Your health is your responsibility. Share this video to help others stay informed. Subscribe for more life-saving health tips. Stay aware, stay proactive. Thanks for watching. Take care of yourself and your loved ones.